Okay, good afternoon, everyone. It's Wednesday, February 21st, 2024. It's 4:30 p.m. I'm calling the regular meeting of the Dubuque County Health Department, the Board of Health meeting. I'm beginning the meeting. We'll start with roll call. And Patricia Lemkiel. Here. Amy Crow-Sunley. Here. Dr. Preeti Joseph. Here. Sandra Larson here. Anybody on Zoom?
We just have Wesley Rich. Can you confirm that you can hear us?
Yes, I'm here.
Oh, good. Thank you. Just double checking to make sure you could hear.
Okay. I was aware that Jess Smith was unable to be here today, and Mike Fidgen was also unable to be here. We think that Tut will be coming. He accepted the invitation anyway. So at this time, I'd like to invite public comments. If you are on Zoom or you're in the room, please stand up and state your name and address. And you can ask a question that relates to things that are on the agenda tonight. Individual remarks will be limited to 3 minutes. Is there anyone that would like to speak today? Seeing none, we'll go on to chairperson announcements and updates. So a couple things. First of all, I was the recipient of a postcard in the mail from the health department. I don't know if everyone else got one, but I thought that was great, you guys. Yeah. Thank you very much. And I also had my own water tested by the health department. They came out and it was a harmless procedure. So congratulations on that. And this I'm just going to give to you guys. I was worried before I got my results back. All of the results were good for my water test, but I was worried, what will I do if my water is bad? So this is what Minnesota hands out. Just something to look at. Real comprehensive what to do if you've got something in your water. Next, I had the pleasure of attending Public Health Day at the Iowa State Capitol. And unbeknownst to me, I didn't know that our health department was going to be there also. So I just ran into them and it was so nice. They represented the Dubuque County so well, I thought. So I appreciate them being there. Lots of stuff is going on at the legislature. And so I just encourage everyone to keep aware of what's going on there. I got to meet with an old friend while I was there. It's a nurse that I mentored, and I was her supervisor in Michigan before I became an attorney. And she married a doctor and ended up in Iowa and ran for the legislature. So she's now the representative that's in charge of HHS legislation. So a real important person, and it was a real pleasure to meet with her. I don't agree with a lot of things that she proposes, but still an important person, I think, for us to know. So that was interesting. I tried to meet with my own senator and representative, and they did not respond to my invitation whatsoever. Didn't acknowledge that I even said hi. So I was disappointed about that. It was Shannon Lundgren and Carrie Colker, and just no response whatsoever. Our friend, the health department's friend, Eisenhart, was there and met with several of our employees that were there. So that was great. Okay, and then lastly, I had the pleasure of going with Carissa to the Liberty Recovery Community place here in Dubuque, and we met with Michelle Mihalakis. And she really has a lot of passion for what she's doing. And I know that Carissa and her group will be taking a look at that recovery community. I think they're doing great work there. So if it works out and we can help them, that would be great. I think that's all I have today. So we'll move on. Oh, the Board of Supervisors, Board of Health Liaison is not here tonight. And I don't believe any of the other supervisors are on. So we can move on from that. Next, I invite a motion to approve the agenda for February 21st, 2023.
I move we approve the agenda for February 21st, 2024, actually.
Oh, yeah,
I'll second.
a little error on our agenda. It is 2024.
Oh, I'm sorry.
That's okay.
Completely
It's hard to
missed it.
keep up, really. All right, so, any discussion concerning the agenda? Hearing none, all those in favor of the agenda say aye. Aye. The agenda is approved. Next, is there a motion to approve the 2 minutes from, January 17th and January 11th, 2024?
Motion.
Is there a second?
I'll second.
Any discussion? Hearing none, those in favor of approving the minutes, say aye.
Aye.
Those opposed? The motion passes. Next, we will have a presentation and reports. First from the environmental health, there'll be an environmental health report.
Are we doing reports or are we doing consent agenda?
I'm not sure what the environmental health report is. So
The brief
I
synopsis.
think that'll be a brief report.
Before we, sorry, before we do that, I just want to make sure I have everyone admitted. I think last meeting, there was a comment that there were some people waiting to join the meeting for some time that maybe were sitting in the waiting room that we weren't aware of. But it does not look like that's the case today. Okay, thank you. Sorry to interrupt.
So I just wanted to give a brief update on where we are with the Grantston County's private well testing. A few weeks ago, we sent out 4,000 postcards to homeowners served by a private well. We have an additional 3,315 to send out and are anticipating a good outcome from that. Every week, we're testing anywhere from 25 to 30 wells all over Dubuque County. And as of today, we have tested a total of 140 private wells and have another 204 prospective tests to be scheduled due to the postcards. To date, we have spent over 29,000 of our grant funding and will be spending roughly 33,000 more on the prospective tests. This will take our total spent to above 60,000. We've received a total of 50,505 this fiscal year and are eligible to receive another 50,000 in reallocation funds, which we have accepted. We will be expecting similar numbers when we send the additional 3,315 postcards out, which will bring our total within the realm of $90,000. Out of 140 water tests, 27 of those came back positive with total coliform bacteria, 10 positive with E. coli, and 15 high nitrate levels exceeding the 10 milligrams per liter. For the wells that come back positive with total coliform bacteria and E. coli, we recommend to the homeowner that they get their well shocked by a company certified with the DNR, and they will get up to a $300 reimbursement, which is funded by Grantston Counties. Grantston County also reimburses up to $500 for well pluggings and up to $500 for well assessments and $1,000 for well reconstruction. Another update, Noah and I have been working on updating all of our forms, which we are currently reworking the septic application and a permit to a one-page form that is more informative, efficient, and clear, along with the septic inspection form, which will include a more thorough and organized document that will provide greater detail to homeowners, contractors, and our department staff.
Great.
That's the update.
Does anyone have any questions?
How long is the current form?
About 5 pages. Yeah. A lot of signatures, a lot of unnecessary things.
And
A lot
a
of
little
repeat.
redundant.
Yeah.
Repeat information.
Great.
So it'll be really nice.
They've been working really hard and to be able to 2 years in a row now get funds reallocated from another county to our own just really speaks to the work that's being done. So
What's the
Proud of you guys.
chances of using it all up? That
Pretty
impossible?
high.
Yeah.
Is it pretty
Like
high?
I almost think guaranteed, but I won't say guaranteed.
Wow, great. That's good news, isn't it?
Last year you used them all and then you got extra, correct?
Yes.
I
Yep.
think we ended up using, I think it was like 127% of what the original was.
Mhm.
So I don't know exactly what that comes out to,
But not
little-
quite all of the
Yeah.
extra that came in, I don't
Yeah,
think.
it'd be a little over 60,000, I think, but now we'll be a little over 100,000, which
Great.
So just for my knowledge, like, how often are you supposed to test your wells?
Once a year.
Once a year? So are you seeing some repeat
Mhm.
people?
Yep, people are starting to repeat,
They're repeat.
and there are a lot that they'll say they haven't got it tested for
That's what I
the
was
25
wondering.
years that
That's-
they've lived there.
That's what I was wondering, if
So-
you're seeing some people that have never
Yep.
done it before.
Yep, many people haven't done it before, but
Oh,
we are starting to
great.
see a lot of people repeat as well, which is really good.
Good.
And we give out magnets. A lot of people have been writing the date that they get it tested so that they can call us next year, we'll call them next year. So.
That's great.
Do you have a database of homes that haven't been tested so that you can kind of
Um,
focus on?
so we did get a list of everyone on a private well in the county. So, I think we've had,
The county kind of lacks databases right now, and it's something we're working on, getting more in the know with what ones we have tested and what ones we haven't, but right now there's not a certain database that covers everything.
Great. Any other questions?
Saw that, good.
Thank you. I appreciate that. Yeah, call it out if you can.
Okay, next, a brief report from opioid settlement funds. Carissa?
Yeah. I'll breeze probably pretty quickly here. We're just gonna use the same presentation that I used for the opioid subcommittee meeting, just to kind of glance over it. So I didn't do the big one. So I just kind of wanted to share, with every meeting, kind of the things I've been up to in the past month to keep people up to speed, who I've met with, what we're working on, like, the website continues to be working on. I'm working closely with Jeff Miller in GIS to complete that. Who I've spoken to, kind of events we've gone to, and just overall kind of, hey, what have you been doing over this past month? Like just letting people know what's going on. Another thing we talked about in the opioid subcommittee meeting was the possible purchase of Narcan vending machines. They look a little bit more like boxes, not necessarily vending machines. If you want to scroll one more page down, I think it'll give you a good image of what they can look like. And then our auditor, Kevin Dragato, brought up a good point that there's a bunch of unused newspaper boxes just sitting somewhere. And so we're looking into the opportunity to maybe reuse those empty boxes and place those throughout the community as those Narcan machines instead of having to spend, I think it's like 500 per box. And then there's a bit of math later on in the presentation too, but trying to cut costs if they're gonna be placed inside. If we wanted any outdoors, that would be a different story because they have to be kind of temperature regulated, so that's where these boxes would come in. But if they could be placed inside someplace, the newspaper machines would work great. You would just kind of have to wrap them. So that was a topic of discussion. And then you want to scroll just a little bit more? Sorry, Ally.
Don't be.
Here's other images of what these kind of look like, a little bit bigger. I think they hold up to 200 boxes. I don't know if we would originally fill it all the way, just depending on, kind of want to see what the use is before we purchase too many, and then what if they expire or something like that, but that's kind of what they would look like if we went this route. And then estimated costs, they vary with shipping. 3 to 5 boxes is the same shipping amount. 1 to 2, it varies, but this is just like if we started off with 3 boxes, the different amounts they could cost. So if we use the newspaper ones, it could cut by a huge amount and a lot of savings to put towards other initiatives. And then another thing I just want to touch on real quick is there is free Narcan from the state, which I have actually applied for now and got approved. So we can use it from the state, but they cannot go in these boxes because the Narcan that comes for free from the state, you have to individually give to each person. So it wouldn't fit. It wouldn't work just putting it in a box because that's not part of the regulations that come with it. So the Narcan that would go in these boxes would have to be bought with assumed settlement funds. So that's more where the price would come from, is purchasing the Narcan to put in these machines. And then if anybody has questions at any point, let me know.
The boxes, single-use boxes that you would have,
Mm-hmm.
do they have to go through the 3-minute education before they can get it?
Yes.
Okay.
I have to do like a quick 3-minute training before giving it to the person, but yes. And then, talked about different locations. One would be there is a harm reduction, I guess you'd call it, a lockbox at the New Day Clinic right now that's already in place. So putting one with that because Narcan can't go in the lockbox because it's not temperature regulated. So that would be one place. And then we are currently talking Hillcrest is working on finding another location for their additional lockbox, possibly down by the United Way was our last discussion earlier this week. And so if that lockbox ended up being outdoors, then we could consider buying an outdoor Narcan vending machine box. I keep using the same words back and forth, so sorry for the confusion. But otherwise, putting the Narcan right next to those boxes, I think would really go well hand in hand because they can't be one inside of the other. And then another thing we talked about is maybe working with county fire departments if they would, or city fire departments if they would be interested in using the boxes as well. But just other locations that would be best fit for the most use of these boxes, the most concentrated areas. So kind of deciding what best locations would be for these.
Hey, question, this is Todd. w- in situations where this saves lives, how does it usually get accessed? Like what's the best way to get it in the hands of people who are going to use it the most?
I think like evidence-based wise is just kind of like using these boxes or just getting it out for free. In general, I'd like to think for Dubuque County, I know ASAC does a lot right now with giving it out. You can go to them at any point and get a free box yourself. They also do trainings, so like our building ourselves has their own Narcan. I believe EMS uses it a lot. I know Evan Hudson does a lot with Dubuque harm reduction and getting it into the hands of people. I don't have data on hand on exactly where in Dubuque County specifically, but I think putting it in the community for free access is the most evidence-based way that it gets in the hands of people that it's supposed to, if that answers your question.
Yeah, I mean, I didn't know. It's getting it in the hands of people ahead of time, right? And then they just happen to be carrying it when they're in these situations and then they can inject somebody?
Yes, and then the ones we have is specifically nasal spray. There is injectables, but these boxes carry the ones that you just spray in someone's nose.
Okay.
Who's regulating, who's monitoring these boxes or who's going to?
So that would be also a topic of discussion. If it was with the fire departments, then we could have like a cohesive relationship where, hey, check in, is this low? I can come fill it. If it was maybe with, I know some groups work a lot with harm reduction. So maybe I'd work with Evan or other people. If it was outside, say United Way with a lockbox, I would probably do a lot of work of checking in, making sure, and then we would have a working relationship. Is my best guess on how that would go.
And can they get more than one unit per code, or how does that, can they pick up like all 12 and walk away?
Yes, they could. Yeah, so that would be something to consider if we refill it and then all of a sudden they're gone again, but you don't also want to monitor it too closely because that prevents people from accessing it. So it'd be something we'd have to try and balance out best. But yes, to answer your question, it would be something they could do.
Have you talked to NAMI or Fountain of Youth about having the box in their offices?
Not yet, but that's a good idea. I've talked to Caprice before and he said he would want Narcan. He would just want to be trained, which obviously could do it anytime. And then NAMI I just spoke with recently regarding like their information on our website, but I could talk to them definitely about them. If they wanted it inside and were comfortable with it, that'd be a good place for it.
Liberty Recovery said that she would be amenable to it.
Oh, good. Yeah.
What's the difference between, I don't want to take too much time, but what's the difference between the ones that you would buy and the ones that would come from the TH? Because you don't plug either of them in, correct? Is one just, I don't think the ones that you would buy would have any distinct advantage.
If you want to scroll, sorry, back up to the second slide. This is the information I got from the manufacturer. Just one more. There we go.
Right here?
Yes. It's kind of hard to see, so but it says they are weather resistant and made to be outside.
Yeah, but it's not that they're temperature controlled. It's just that the materials are meant to withstand elements, correct?
I
Well, it
I mean, I
says
guess
no-
so.
Cause no electricity.
required.
So I just don't see what the benefit of spending $500. But I don't know if we're gonna vote on that today or not anyway.
Newspaper boxes are probably meant to be outside too.
Mhm.
I mean, because when it says no electricity required, it makes you think,
That was a discussion that we had too. It does say need to be outdoors. But I think that's something that we had considered as well, as seeing if there is a unit that is temperature controlled. Do they need to be temperature controlled?
Hey, so
so then why aren't, I mean, it's interesting if they need to be temperature controlled, but these aren't temperature controlled.
Hey, real quick, just a quick Google. It says it freezes below 5 degrees, the nasal spray.
Yes.
But if you're not running up to this thing to grab one out and then instantly try and spray it in someone's nose, it probably doesn't matter, right? I'm trying to Google if high temps
I think
cause
it's
issues.
it's the high temps that are
Yeah.
worse than the low
Yeah.
temps.
Mhm.
I think it's like any medication, if it freezes or gets
Yeah.
too warm, the efficacy
Yeah.
of the medication, the effectiveness, the potency of it, is not what it should be.
Yeah, so right here, just on of the spray, it says it needs to be between 5 degrees and 104 degrees. So it can't, if you go outside of those, it probably messes with the efficacy or something.
Let's not freeze.
Hmm.
4 months in Iowa.
Mhm.
Yeah, yeah.
So weather resistant.
I think that's just the container. I don't think there's any difference between that and a newspaper container, quite honestly.
Weather resistant need to be outside.
I don't
It
think these
actually
can't
be-
be outside.
It'd actually be better inside anyway, because someone
Yes.
could kind of monitor it. I know not closely.
So
but-
they're not taken out 12.
Right, because I think all boxes will be removed
Yeah.
probably by one person most of the time. So I mean, to have it inside might be just a little safer, just thinking. But go ahead, Carissa.
Are there any outstanding questions from that I didn't answer? Okay. Thank you. And then I'll zoom right there in. After Narcan, we talked about locations, and then we talked about the TrueNarc just because it was a topic of discussion in the previous meeting, and we brought in Adam Williams from the Drug Task Force to clarify any questions or information regarding this item. From our discussion, it appears that it is helpful in assisting the Drug Task Force, the Sheriff's Department, or the Police Department with not having to open a bag or container and take out the drugs to test the drugs. So it's kind of preventing additional exposure. And then it can also assist with identifying trends or different drugs maybe they haven't seen before because it, or substances, sorry, it identifies more than 530 different illicit things. So there is some pros to it. I know there's also a topic of discussion of using money towards police and criminal justice system. So that is something to consider as well. But just wanted to make sure I brought someone in to explain the facts of kind of what it is and what it can be used for. So that's kind of where this discussion went. And so it is something considered to be used for funds, but has not been declared yet. And then just to discuss, the subcommittee is right now a little bit more advisory and we'll kind of transition into a working group. So just making sure all the different areas in which people could come from to add to that working group were considered. In case I wasn't considering anyone, it would probably be 10 to 12 people. So hopefully one person can represent multiple areas, but just making sure we're thinking of everyone to be considered for the subcommittee group. And then the last thing, sorry for the long discussion, is the opioid response network. I've been working with them because they offer free assistance in regards to the opioid response. So they are helping, bless you. me or us with creating a strategic plan for the opioid subcommittee. So I met with them recently. I double checked and I'm still waiting for them to get back with me about the next step in creating the strategic plan because we're looking to cater one specifically towards Dubuque County. So waiting anxiously for them to respond, but going in the right steps, and they know that we're working to want to develop a strategic plan as soon as possible and continue moving to spend the funds. So hopefully we can work together soon. I believe that should be everything.
I think with that amount of money, that strategic plan is really important. So I think it's easy to otherwise kind of get down different, avenues, and I think that'll be really important.
I do have a question. Once that working subcommittee gets formed, is there a committee of the health department that will be advising that subcommittee?
I don't know, what do you think?
I think there should be.
So a committee on a committee?
Well, I mean, a subcommittee is a subcommittee, and they should report to a committee rather than the full board, I think.
How would that look though? Cause I mean, as far as meetings and things, I mean, so they would have their meeting and then they'd have to have one with the subcommittee?
The subcommittee would meet. There could be somebody on the, board on the subcommittee. And then, they could meet after the subcommittee meeting. I don't know. I'm just wondering.
Yeah,
I don't know. It just seems strange that you'd have a subcommittee, but not a committee that they would report to.
and actually, Carissa's been calling this kind of a working group, so we could still have the subcommittee that's been meeting. And when the working group is ready to report something, then I suppose we could have a subcommittee meeting. Is that kind of how you're seeing it?
Well, I'm seeing it more, moving it to a committee so that the committee kind of filters everything out. So we don't, like, they bring to the report to the board and say, this is our motion, this is what we want to vote on. So that we don't have to listen to the whole spiel every meeting.
And, I mean, Carissa is kind of in charge of this opioid settlement funds. Wouldn't she be coming to the board with the recommendations rather than a committee?
But she can't make the motion.
Well,
I don't know, it's something to consider.
yeah, I mean, I'm definitely open to that, and I would like everyone's input about it. But thank you for the idea. I think that the most efficient way we can do it is what I'm for, so. So that's something we can talk about, maybe have it on the agenda for the next opioid committee meeting. I was wondering when there would be recommendations coming, actually, to the Board of Health. Would you say you're still a few months out on that, or?
I don't know, cause I feel definitely really comfortable and really eager to at least start on the Narcan distribution in the community for one, cause I think that's something very simple, evidence-based that could be an immediate help. I just wanna make sure it's well thought out process and all the questions are already sound and answered. I would love to do that as soon as possible. As for bigger items, that probably will take a little bit longer. And then as long as the pieces fall, I can connect with the newspaper person and we can agree on spaces to put the things. I would love to get that out there, something as soon as possible, so.
So one other question, you have to go to the Board of Supervisors, so maybe it wouldn't make sense to have a committee because it has to go to the Board of Supervisors for approval anyway. We would
It
just,
comes here first to the Board of Health, gets the recommendations. We discuss them, we decide what we want to send on to the Board of Supervisors.
So when do you see starting to have the meetings with the bigger group that you were talking about?
I would say, I think the opioid subcommittee, the advisory group would probably meet again in March, and I was hoping to have a point of discussion about it. Because I'm already getting inquiries from other people in other groups wanting to be a part of this working group. And so I think soon would be.
Cause I'm just thinking, if you're thinking about like where to put these boxes, I mean, this group of people you have here may have a lot better ideas than some of us sitting around this table. I mean, to me, that's really the group that's gonna be able to, excuse me, help you with that.
Okay. Anything else you'd like to share with us?
No, that's everything.
All right. Thank you
Thank you.
very much. Okay, the Board of Health, the department's Board of Health report, Ally, and then the DNA report. I guess we don't have them on our agenda, but or is it- is it-
I did go ahead
Did you-
and add
is it there?
the one that was published,
Okay.
and I do, if I'm not mistaken, we had agreed to do those as like consent agenda, so my understanding would be you reviewed it, and if there are questions about either, I'm happy to answer them on behalf of our department, and we have Brittany here to answer questions about the if there were any questions about the DNA report.
Does anyone have any questions about Ally's report on the public health department? Hearing none, then,
If no questions, can I just, real quick, I just want to make sure that everybody is aware that the Public Health Day on the Hill really kind of is a big deal in our state, and there were a lot of local public health departments there, and there was only one with representation from their Board of Health. So we felt so supported, and just couldn't thank you enough for being there.
oh, thank you. Good.
That is all.
Very nice of you. Okay, any other questions or concerns for the department? Hearing none, do you have anything you'd like to add from the DNA?
Sure, I actually do have a few things
Thank you
outside
for
of.
coming, by the way.
Yeah, thanks for having me again. So for those of you, I know, 2 months in a row, I feel really special. I joked last time that I was gonna start coming because I enjoyed myself so much. So for those of you that I didn't meet last time, I'm Brittany Eubanks. I'm the manager for the VNA. Stacy Killian had her other carpal tunnel surgery on her other hand yesterday. She's doing well. She's just resting at home. So, next month she'll be here. Maybe I'll tag along.
You should.
It's been nice. It's been really nice. But I do have some additional things in, on top of what was reported in Stacy's written report that she sent to Ally. So, we are in the height of grant season. We lovingly refer to this as grant season because that's when most of our Health and Human Services grants get released to be written. So, tobacco, which is one that we work with Ally and the County Health Department on, we are currently in the process of working on that one. Our first 5 grant was released. We are in the midst of that one as well. And our Ryan White grant, which is our medical case management grant for individuals living with HIV and AIDS, that one has been submitted. We anticipate our maternal child health grant and a few of our other grants to be coming out here in the next few weeks or so. They're usually all due around end of March, beginning of April, so it's okay, we get through it. Lots of chocolate. Our ultra cold freezer unit that we worked with Ally on purchasing with some grant dollars, that was installed today at the VNA, so that is an awesome addition. Pfizer is probably the most commonly known pharmaceutical that has to get stored at ultra cold temperatures for that Pfizer COVID vaccine. So now we have the ability to store it at that temperature in-house, which is great. Keeps the shelf life longer, so. And then in other exciting news, the Bridge program, which was developed when the COVID vaccines went commercial, they extended that for us, and we had the opportunity to order some flu vaccines for the 2024-2025 flu season for adults. That's not something we historically have been able to have. We usually just do pediatric flu vaccines through our VFC program. But we will have those available in the 24-25 flu season. The requirements to receive those are the same as COVID. So someone who is underinsured or not insured at all. So But it is nice. I think, I want to say we ordered right around 200 doses of those, so, in our pre-order, so it's exciting to be able to offer them.
And you'll get those like September or October?
Yeah, usually we'll probably get them around the same time as our VFC, which is usually around
And-
September.
VFC is,
Vaccines for Children's Program.
I knew that, but I didn't know Tut knew that.
Yeah, sorry, our acronyms.
Are you seeing any walk-ins these days for any vaccines?
No,
You still have
it's
Friday
really
nights?
slow. Yep, so we still offer it, so we have COVID vaccines, you can still walk in, it's just when it went commercial and our requirements of who's eligible changed.
Yeah.
A lot of our walk-in traffic dissipated, yeah. Which is unfortunate, but, yes, we will give it if they qualify, and if they don't, we will help them get connected.
Brittany, do you know, the legislature, one of the things they're doing is they're trying to expand Medicaid coverage for postpartum.
Yes.
Make it longer, but in the same bill, they're reducing the number of women who will be eligible, women and children. Do you know how that's gonna affect your caseload or?
So our maternal health program for us, we can serve those that aren't on Medicaid, so it's through the Title V funding. So some of our women are privately insured, some are Medicaid, some have no insurance. So for us, it probably won't affect our volumes as much. Reimbursement, if it was a woman who would have been Medicaid eligible who no longer has it, if we can't bill Medicaid, obviously that may affect reimbursement, but it shouldn't affect us too terribly. We'll still serve the same population and capture those women just through our Title V grant dollars then.
Then on another note, on the vaccinations, I understand that there's been more religious exemptions given this year. And so there are fewer children being vaccinated, and there are measles in Minnesota, I know. Have we had any measles here? And is there something that maybe we could do as a public health department to educate what to do in case someone has measles or something like that?
Sure, I mean,
Because-
I think we can definitely work with Ally. I think that would be a prime opportunity for us to work with Ally and the county department on getting some PSAs out for social media and campaigns and things like that, for sure.
Yeah, that'd be good.
Yeah, but to answer your question, no.
No measles
We
been
haven't gotten
reported
any
or-
notification. Ally and our office both get those
Okay.
notifications, and we haven't seen anything for Gary at all.
Great.
Yeah.
Thank you. Anybody else have any questions or comments for VNA? Okay, then both of those reports will be accepted. Let's see. The next item on the agenda is an action item, a variance request for 10018 Shawandassi Drive, Dubuque. Is this one we saw before?
Yes.
Okay.
So back at the December Board of Health meeting, Dave Harrington came in front of the board and requested a few variances to install a new leach field on his property. So I'm just gonna read a list of variances from Ken Beaton's letter. The variances that are specifically needed are to allow a setback distance of 90 feet versus the required minimum of 100 feet from the well at 10042 Shawnandassi Drive. Allow a setback distance of 70 feet versus the required minimum of 100 feet from the well at 10018 Shawnandassi. And allow a setback distance of 90 feet versus the required of 100 feet from the well at 1000 Shawnandassi. And allow a portion of the septic treatment system to utilize the southerly 10-foot of the west 75 feet of Dave Harrington's property adjacent to the property owner at the 1000 Shawnandassi, which is Jerry Ivan's property, and to allow a portion of the septic treatment system to utilize the westerly 10 feet of Dave Harrington's property adjacent to the railroad property. So I have, the board wanted letters from each one of these, the railroad company, Dave Harrington and Jerry Ivan. So that's what we have is those letters, and then I'll sign.
Oh, is that who the CPKC? I was wondering who that was. Is that the railroad?
Yep. So this is just letters stating that they're all okay with the variance, they're in agreement.
the neighboring properties.
Yep.
Okay, does that have to be in the deeds or anything, or just these letters are okay? That's a legal question. And, we don't have our county attorney here, so he's not here to answer that, but,
I don't know,
I
but
mean,
it would
I'm
make
not
sense to
sure
have
on
a-
that. Maybe, I'm not sure on the deed, maybe, the abstract.
It would make sense because
Mhm.
they might get questioned.
Yeah,
yeah.
yeah. I mean, and they
Like the
could, I
next
mean, they
owner or
have the,
something. These letters, I mean, they're probably gonna be on file in our department, but I don't know that a new buyer would know to check with us or anything, so.
or to have them like recorded at the
Yeah.
court.
This would have, I mean, how can this not go in the abstract, right?
Well,
Yeah,
that's what
I
I'm
should-
wondering too. So
should go in
I
there.
think we're gonna have to get an opinion from our county attorney on that. Don't you all think
I
that?
think it would be the best practice
Yeah.
to have it added to the abstract.
I mean, I think the homeowners did what we asked them to
Yes.
do, but now we have another question, so I apologize for that, but, I do think that we should have an opinion. What do you
Wasn't there
think?
like 3 different options that they were gonna pick, or am I confused?
Yeah,
Or
so
don't we
there
need to
was,
know that?
no, there was the Waterloo shed biofilter and then the leach field.
Yeah.
They want to go with the leach field. And that would mean that they need these approved, these variances, and that's what these letters are for.
Okay, so that's the one they're going.
Do you know why they want to go with that one rather than it's cheaper or something?
No, so I talked to Dave today. He said,
Here.
yeah, Dave. Well, so he stated that he wouldn't have to get a maintenance agreement with the leach field, 'cause with the Waterloo bio filter, you'd have to. It's an annual maintenance agreement. There wouldn't need to be he wouldn't have to put electrical in, it's just.
More
Extra,
standard.
yeah.
Also commonly seen as the best.
Yeah,
It was seen as the best option, you said?
Typically, that's the number one option.
A leach field.
And I
Regardless,
think-
yeah, regardless. of any-
flooding was like a concern out there and with the shed.
It'll be better.
No, I mean, because of flooding,
Oh,
they
the
weren't
flood would hit
sure.
the shed. Yeah, I can
remember that
remember.
picture they
This,
sent.
yeah.
Now it's coming up.
This is one on, down by Massey
Mhm.
someplace, yeah. Okay. Well, I would make a motion to approve pending advice from the county attorney concerning whether these letters need to be somehow in the chain of title.
Hey, sorry, can I just ask a question on stuff like this? Is there an opinion, does the opinion say, based on the soil type and X, Y, and Z factors and the fall line and whatever, there's minimal risk to a well at 82 feet versus 100 feet? Or like, do we not get opinions like that?
No, we have, I mean, we have the whole,
Yeah,
That's a
the whole
confusing
letter,
thing.
yeah,
but it's not in this
but
packet.
he talked about that at the December meeting.
He did, yeah.
Okay,
So there is an engineer, I think he's an engineer.
Yeah, and I mean, there's a whole, at the December meeting, he had a whole packet, which I have, but it's not in.
okay.
Well, Tut wasn't on the board yet, so maybe you could scan that and send it to him just so he can get the whole picture.
Yeah. You can do that.
All right. Based on that, I would second your motion.
Thank you. Any other discussion? Hearing none, those in favor of approving these variances pending the advice of our county attorney, say aye.
Aye.
Those opposed? Okay, so then what we need to do is just let the homeowner know that it's gonna be just a little bit of a delay. We've approved it, but there's one more step that we need to get advice on before we can, give them the final okay.
Okay, so, recommendation from the county attorney, and then to ask if it's supposed to be added into the abstract.
Abstract or chain of title or
Okay.
something like that, Okay.
Do we, real quick, do we just thinking through this with these folks, right? And that like, it feels like spring or summer right now, but I mean, do we need to hold up them planning to do construction on a project and getting people kind of in the loop to do this while we work on figuring out how it needs to be filed or kept track of historically?
Yes, I think, well,
So if this.
yes, I think so, because what what if the county attorney says these improvement, you know, these letters that people have signed mean nothing? Well, then I think we're back at square one. So I wouldn't want them to start the building. That's my opinion. And hopefully the county attorney can give us an opinion pretty quickly. What do you guys think?
Well, we voted on it, so it's passed.
Yeah, I know it's passed, but we can't give the final.
No, but I mean, we can't go back and say, start it, because we voted that
That is
the
pending.
county attorney
Yeah,
needs to.
true.
I think what I would say to answer your question, or hopefully answer your question, Tut, is that some of these are like policies and procedures that we are working through from start to finish to make sure that, you know, the practices that we've been following are best practice. So that is a work in progress, just so that you're aware.
Got it. Okay. Sorry, I thought we were just asking the county attorney about how we should file this and keep track of it. I didn't realize that I thought all the letters that they got and getting people to sign off on it and all that was what actually allowed us to say, we're okay with this.
I understand your confusion. I'm a little confused myself, so. But I just think that we have to assure that we're doing it correctly from a legal standpoint also. So I think the board would feel more comfortable if the attorney pipes in on it, so.
Okay, got it. Okay.
Okay. Thank you though for your input, Tut. It's appreciated. Next we have response to public questions. And I don't think I really got any public questions. I got some concerns from the public.
I got an email.
Yep, go ahead.
Let me just pull it up so I can make sure I get her name right. I got an email yesterday from Abby Deeganhart, who's the Dubuque County Early Childhood Director. And she was wondering, well, let me just read part of her email. We are state funded and fund local programming that supports children 0 to 5 and their families. I would like to know more about what Dubuque is doing locally for behavioral health. I would like to be included in local meetings that discuss this. So I emailed back that we were meeting today and I invited her to this meeting. I also asked her if she was a part of the Wellness Coalition, the Early Childhood and, Brittany, Early Child and Maternal Health
Maternal health councils.
councils. And I have not heard back from her, but if she's not part of those, I'm gonna forward her name to Vicky and Lori. And also maybe the Cha-Chip too. Ally, she might be interested. Are we doing committees with that still, or?
Not formally right now, but
Okay.
those are initiatives we're still working on. Is this something that maybe we should include Samantha in on, Samantha Berglund?
I mean, maybe, but she's not behavioral health, but
Mental Health Disability Services Coordinator.
I mean, you could, I mean, it wouldn't hurt, but I did not give her Samantha's name because that's all being reconfigured.
Okay.
But I just wanted to let everybody know I did get that email yesterday. And I let her know that I am first and foremost for behavioral health in the county of Dubuque, so I'm always advocating.
Thank you.
Thank you, Amy. All right, so then, we have no unfinished business listed, nor new business. So we can have, does anyone have anything they want to bring up? Board communication and reports. Any board members want to share anything with the board in fall? Seeing nothing, then we can go on to our next meeting, which will be
March 20th, 2024 at 4:30. Same place.
Next, we have public comment. At this time, anyone may address the board on matters which are of concern to that person, which are not agenda items. Please raise your hand if you're on Zoom or stand up if you're in the room. State your name and home address. Please be aware that we are limited to in our ability to respond to such inquiries by the Iowa Code. and you will have 3 minutes allotted for your comments. Anything? Seeing nothing, then we can move on to our work session. The work session tonight has to do with our draft of the strategic plan.
Can we make that full screen? You don't really know how to do that, Ally.
If we do that, we're gonna lose people on the side.
That's okay, we don't need to see them, we just need to hear them.
Yeah, what did
15
he
different
do?
buttons, so I'm
Yeah,
not-
like, yeah, it's a 10-step process.
I remember that, yeah.
Some wizardry.
I guess, I'm sorry, this is as big as I can.
That's okay, it's bigger, so that's good.
The, next to the settings, does that do anything? Like by the search thing up on the right side of down, sorry.
By that.
Does that do anything?
I know.
Well, that's on this screen,
Okay,
maybe.
maybe not.
Yeah, that's good.
Better?
Mm-hmm.
Okay.
Okay, so I think Wesley Rich is here. He was one of our consultants, correct?
Correct.
Hi, Wesley.
Hey guys, how was Dubuque, Iowa this fine evening?
Well, we're warm. We're not really having a winter, so we haven't gotten to have our snow days or our hot soup or any of those things.
Oh
The good
no.
things. You know, remember the good things about Dubuque County in the winter, so.
Yeah, yeah,
Yeah.
I remember back porch fridge was one of the
Have not had
things.
those either.
Oh, that's no good.
Yeah. So, so anyway, thank you for being here tonight and, thank you for, any input that you have, as we go along here. Ally, did you have any comments to begin with or?
I did not.
Okay.
I guess I was kind of thinking if we could go through page by page and if anybody had input for that page, but if you would like to do it another way.
No, that's fine. I'll just, for an overbroad review of this, I question whether it's too ambitious. Because I want the department to be successful. And if I look at, the last 4 pages or so, 3 pages of all the things that you have to get done in 3 years is a lot. So, as we're going through this, maybe we can think about, tiering, for instance, the quarterly, meetings with the public. Maybe we start out 1 year with 2 and then move up to 3 in a year and then move up to 4. Just something like that, because like I said, I do want the department to succeed on this. And so I don't want to make it too big, so. All right, so anybody want to change page 1? Page 2, the first page really is the process. And it does mention in the 1, 2, 3, third paragraph, the crucial objectives. And that is really our main items, leveraging data for decision-making, genuinely engaging the community, refining internal policies for efficiency, and fortifying the workforce for future challenges. So those are really our 4 most critical objectives. Does anyone have anything they'd like to add or change or?
No, I really thought this page was good.
Okay, on the next page, this states our vision, our mission, and our values. And I just have a typographical error here under professionalism on the right side as you look at it. It should say, I think we will maintain strong expertise and effective communication as we serve our
no
community.
Yeah, good catch.
So it was fun coming up with this vision and this mission statement. What does the board think of it? Any comments?
I'm not bored, but
No, the
Um,
department is, actually, the department is the most important, so.
Um, I like the process of this included all of our input. So I think it really captures what we want to accomplish. I think it's good.
I would agree.
So then, the next page, strategy at a glance, theory of action. I thought maybe Rich could give us just some comments about this page, just to help us understand what this is showing.
Sure. It's often that organizations want to see sort of how these strategic goals are going to interact with each other. And, as we went through this process, and you guys remember very well, no one of the key initiatives or even the activities work in isolation. And so this was an attempt to show that across the individual strategic goals that there are intersections among them, particularly in places like targeted resource allocation. Well, that's going to intersect all of the strategic goals, whether we're talking about data informed decision making or efficiency in operations. And the same thing is true when we talk about not just intersections, that these things are going to impact each other, but synergies that they'll actually have an impact together um, across those goals as well. And so ultimately, what is it we want to see happen? A theory of action is sort of a logic statement. If we do this, then this will happen, then this will happen, and then we see this outcome. And so you guys have a pretty complicated set of strategies that do interact very well, and this was an attempt to capture that.
Okay, thank you. Questions or comments?
I like the ultimate impacts. I like the way they're worded. And I like that they really, I think, are very doable.
Yes, thank you. I think so too. All right, next, we go on to strategic goal number 1, the leverage of data-driven insights for informed decision-making. We do have a challenge in this respect in getting the budget approved for some data analytics
Yeah.
software.
Do you want me to share just so that everyone kind of knows where?
Sure.
And I think so Wes can.
Where we're at with that? Okay, so, about the time that this report in front of us came out was about the time that capital improvement requests were due to the Board of Supervisors from each department. Really, the timing of it didn't allow for a lot of, research to know exactly what the cost of this is. It definitely is more costly than probably what I had anticipated. So I've been in front of the Board of Supervisors twice with 2 different numbers. One was $11,000 for the year and the other was 50. And it didn't take me long to realize $11,000 was not enough. So just yesterday, just yesterday, I did ask the supervisors for $50,000 and that request was not approved. Instead, it was recommended that we continue to do our research and come up with a solid amount that we think we need to be able to accomplish this goal, and then to make that request via a budget amendment rather than a capital improvement request. So I do feel that the supervisors are hearing what we want to do. I've not heard any opposition to the plan. And in working with our IT department as well, I think we're all on the same page that it needs to happen. We're just not to the point where we have enough information to make a solid request.
Did you have a specific vendor in mind with that 50,000 or?
So, I had actually asked, our strategic planners if they knew of, companies, right, that work specifically with public health and data analytics, because I wanted to kind of first start with what's tried and true and recommended. So we are having conversations with, a couple vendors, but not pigeonholing ourselves into just that one either. And that company that I had spoken with, the initial, number that they gave was really pretty high, more than probably what I think we would have wanted to afford. And so we are working with them with kind of a scaled back version to just get started, maybe start with one or a couple, data points, but that software would expand and grow with us as we grew into it. I don't want to bite off more than we can chew, because I think this is huge. And I think there's a steep learning curve with it too. The software is nothing if we don't have the proper education for all of our staff to utilize it. And there's just a lot of factors to consider, and I want to get it right, so.
And this
Yeah.
would be for environmental health or?
Both, we can tailor it towards our needs. There are, a couple local public health departments in Iowa that are already using one of the vendors that we're considering. So we're just kind of looking at that as an option, but knowing that it can be tailored to what we
Well, when
need.
you said scale back, I didn't know if you were just gonna like pilot it with environmental health, or like, what are you thinking? What data would you be collecting?
Well, I think that can be determined, but it's not gonna be a full-fledged, fully integrated system to start with.
Because does the VNA do probably some of it already with vaccinations?
We have certain databases that we use that are part of Health and Human Services or what's accessible to us through our grants. And we actually met with Ally, Stacy and I met with Ally, and forgive me, I forget the IT gentleman. Nathan, from the county. We kind of talked about what data sets we're able to provide from what we get, and how we can collaborate to make sure that whatever the county has is a true representation and encompasses all the data that is available.
Yeah, so that sounds exactly like you've already started implementing the plan. One of the first steps was to sort of map those things out and understand, what you're collecting and who has it. And it's probably unintentionally siloed in several places. And Ally, I know you got to have a little back and forth with David about, what he might recommend. I think he talked about Tableau as an option. And those are powerful, robust tools that can grow with you. But there are others, in terms of meeting the needs now and then trying to scale it up later. And so you and I could probably have some offline conversation about what those might be, and a price point that the Board of Supervisors might be willing to swallow. But I'd be glad to work with you on that. But I do think that the actual strategic goal is important, that you map the data, that you understand the data sources, and that you begin training your folks to use the data expression tools that are available.
Ally, is this anything that other departments in the county could also use this software?
That's a great question. And that was actually, that question came up today because Nathan and I did meet with one of the potential vendors, and that was a question that came up. I think there's the potential for that.
Because that will also help.
That's what I was
Yeah,
thinking
yeah.
too, some cost sharing.
Yeah. Mike Fidgen did I asked him to give us some comments since he couldn't be here, to give us some comments, what he thought. And this is one section that Mike Fidgen did. He's concerned about the cost and wanted to get recommendations about what kind of products. But he also used something called key performance indices or indicators. And that's for like a dashboard, he said. And he said that maybe we could work with our consultants to get some of that defined. The key performance indicators.
KPIs, yeah,
Yeah.
we use, I mean, it's like, what do you want to look at? and what are your goals? So then you're always looking at the same thing. You know, we use those.
Oh, good, yeah, so we have, I mean, it's a challenge, but not an overwhelming challenge, and I mean, I think we all agree this needs to be data driven, so.
And do we know what the city public health uses? I mean, do they have something?
I think they do. I think they're pretty resource rich. And I know we were gonna check with them. Mary Rose is out of the office currently, right, I think, but, I don't know what they use, but they do have more resources available to them.
So there could be some
It'd be
piggybacking.
really nice if you had something to talk to each other.
Yeah,
Yeah.
yeah, definitely.
Okay, anyone else have any things they want to talk about on this page about the data-driven insights? Okay. Next page, strategic goal number 2, engage the community authentically and meaningfully. And I think this is, I mean, I just love these ideas of getting out into the community because,
And I think it's already started. Noah and I think Chrissy, you were there too, at Western Dubuque's, even though it's not as robust as you'd hoped it would be. But I mean, that was a big thing. You're going to be at the Hidden in Plain site. So we're already implementing strategic goal number 2 as well.
so this is kind of where, down here, key initiatives under 2.2, it says host quarterly town hall sessions to discuss health concerns, gather input and share information. And that's just where I wanted to talk, have us discuss, maybe we should work into this slowly.
Well, I mean, technically, we've already done one of those last year in Epworth. So.
Yeah, we did get a good start.
Mhm.
We made it a
So we
few
did one in
different
that
places.
year, so we could do 2 this year.
Well, and we went to Key West.
Correct.
So, I mean,
Yeah.
the process has started. We just need to advertise better. And I don't know, maybe make it a different time or.
You had
day
a
or
town
something.
hall in Key West.
We did, at Berkey's.
Oh, yeah. So we really did, like, that was part of the vision that I think we all had, was that we're not gonna sit in our department and wait for people to come to us. We wanted to get out and get to some of these communities so that people can, you know, come share their ideas, their thoughts, their concerns. We did, yeah, a few of them, they were not well attended, and there needs to definitely be a different, approach to it, but I think we have the idea right. We just need to make it better.
So,
Maybe advertise, you know, it's like, I think, it's like, you know, in Asbury, there's a little newsletter that comes out, you know, if you put it in there, you know, with plenty of time, maybe just a little more advertising and.
Planning ahead, I think is key. Yeah, good idea.
Is there a way to do an electronic?
Like a mass text
Or are
like
you
a
able
mass.
to put it through so somebody can send you a suggestion electronically, like through a link or?
So on our website, we do have a generic email address.
Maybe, maybe a sub, like, you know how ads and different things come up, you know, like a pop-up or something that says, hey, we're looking for ideas. If you have anything, you know, click and just, I don't know, we're very
Yeah.
electronically, social media-ish driven, so I don't know. if
Right.
there's a different menu to accomplish that goal.
So I just want to draw your attention to 2.3, which is exactly that: leverage social media and other communication platforms for engagement. So you could use your Facebook presence, your Instagram, your TikTok, whatever you're using, to drive people to web-based forum that says, hey, we're doing these quarterly meetings. We're also doing webinars, which is the second bullet under 2.3. What do you want to talk about? What's first and foremost on your mind? And you could sort of have that planned out 6 months ahead of time.
So that, I think that was some of Mike Fission's concerns as far as how are we gonna prioritize organizations? And are these meetings going to be based on our community health needs assessment? How are we gonna choose the topics to focus on during the community forums? And some things like that. So So I guess I want to ask the department, do you think that you can do 4 town hall sessions this year to discuss health concerns, gather input, and share information with the community?
Is it doable? Yeah, I mean, yeah, I think if we have a deadline, we can make it work. But I also think we want it to be meaningful and not something that we're just doing because we have to check that box. So I think I tend to agree with you, that scaling it back, not scratching it by any means. I think it's important, but maybe scaling the frequency back.
Well, and I want to scroll down to the timeline here and make sure you guys haven't locked yourselves in when we were creating that timeline to doing 4 right out of the gate in the first year. Because, the idea is that by the time the plan is fully implemented, you would be doing 4 a year. And so in 3 years, maybe you're pulling that off. Maybe this year you do 1, maybe 2.
And 2 for sure doable.
Yeah. And again, those things, this is a plan you created. I want to remind everyone that as you get into implementation of these plans and you go, 4 is too many, we can only do 3. Well, okay. Go adjust the plan, make a note, and keep rolling.
Possibly just put in 2 to 4.
Mm-hmm. We
Make
could do
some
that.
community- I mean, sometimes if it's COVID year, you're gonna be much more
True.
open to, or measles outbreak or something else happens.
How do you feel about that? To make it a range?
I think that was a good idea, like, what do people want to hear about? To give it more value, I think like you said, like, what are people interested in? What do you want to hear about if we were to come talk to you?
But for now, the CHA would inform that, because we do know what Dubuque County wants from answers on that.
True.
Yeah, you could also split the baby a little bit and say, we have this CHA priority we want to talk about. And then there's a section of this town hall that are your concerns. And we've collected that information and we're going to do a 20-minute session on your concerns.
Yeah, I mean, it's something, I love the idea of it. I'm not gonna lie, it's not something I've ever facilitated. So I would imagine the first step would be planning it. And then kind of researching the different structures that places have used.
So I'm hearing you say 2 to 4. So I'm going to go and amend that bullet before I send you guys back the document.
And then also under 2.2 is conduct workshops at schools throughout the county coupled with surveys to directly engage families and gather health-related data and concerns. And I don't know for sure where that is in the yearly schedule, but is that something that can be done this year? I mean,
Did you have surveys at your table when you were at the meeting?
I don't think so.
and I know that, I mean, all the staff will help with this in the department, but we really have one person that's gonna be doing this. And that's you. So I don't wanna pile too much on either, so,
Oh, I don't think it's all Ally. I think it's a lot of Noah and Carissa for opioid stuff. I don't see this as a,
Carissa's opioid.
I
so
know, but-
she's not really,
but she's got other outreaches that she'll be doing as well.
well, sure, yeah.
So I don't think it's all on Ally. Do you?
It
feel
looks
it's all
like-
on you, Ally?
She's probably.
She's the planner,
Yeah.
she's the organizer. I mean, she has assistants and she has great assistants. But she's gonna be the one that, it's on her shoulders.
Well, the calendar part, but not the staffing part so much.
Not the staffing of it, but the planning of it. I think she'll have help. Again, she'll have help, but I really do think, I mean, I don't know, maybe I'm wrong. But I just don't want to pile too much on her, so.
I very much appreciate that. I think we have shown that we've worked really well together as a team, so I don't feel like I would be shouldering all of this. But it will be on me to assign things and make sure that we keep on track. And really, until you start, you don't know. That's,
How much time it's gonna take, or,
Yeah,
yeah, I know,
yeah.
yeah.
um,
It
Yeah,
looks like this one is planned for January of 25, so you're a little less than a year out.
I think, I mean, for me, Ally, if we gotta trust you, if you say you can do it and you want to do it, then we should let you do it. I mean, it would be like at our bank if one of my board members said they didn't want me to do something like if you want to do it and you think you can accomplish this, we should trust you. That's my opinion.
Thank you for that. So I think back to the day when we were here and we were putting the initiatives on the board and the different tasks and the timeline. I think we have it right. I think we're on the right track. There are maybe just a couple of things that may be worth revisiting and maybe removing. I have a couple things in mind, and again, this is a whole team thing. It's not just me. But I'd just be curious to see it, and since you're able to join us, Wes, kind of what your thoughts are, if there are a couple things that we were to sideline for now, if that's really gonna throw us off.
No, I mean, let me just remind you all that, and you know this already, we've talked about this several times. There's no such thing as a perfect plan. There's a good plan. And you're making choices here about what you do and what you don't do. When we looked at your strategic priorities, you chose a handful of things. The things you didn't choose were not unimportant things. We just recognized and affirmed the fact that we can only do so much. And so we chose the things that we thought were the highest value. And so it is possible to get yourself underneath so many things that you think are high valued that you get nothing done and there's no value from it. So you can absolutely strike anything that you like out of this plan if it creates more margin to do the other parts of the plan, I guess is my point. So there's no linchpin here that if we pull it out, the whole thing collapses. These things are related, but they are not necessarily interdependent, if that makes sense.
It does. That is helpful. And I think that's
What
what you were, exactly what you were saying.
So what were you thinking that you'd wanna maybe scale back on or do?
So
away
I
with?
had asked towards the end of it if we could add the Enneagram thing.
Mhm.
I'm having second thoughts about that. I think that we're a small enough department and I feel like we have open, honest communication. We have good working relationships. Now, if we were struggling and not getting along or something like that, maybe. But I think that would be one of those things, Wes, that maybe is gonna require more input and time than we're gonna get out of it. So
Sure.
that one I would like to strike.
That could be.
Okay.
something Future that we would do if we do grow as a department where.
Yeah.
We do have more working parts, but right now we are still small.
Well, and you're also new too.
That you,
Except for Bailey, and even Bailey, you haven't been here 10 years. So yeah, you're still all figuring out your spots and your, what, priorities are. So I wholeheartedly agree with striking that out.
And where is that? In our
That's
So I
3.2.
so we're looking at different parts. I'm on the timeline.
Oh, okay. It's
Okay.
not 3.2.
3.2.
Yeah. So you could still keep that in there, fostering a positive workplace culture, but get rid of the
For sure.
Enneagram or whatever it is.
For sure.
Okay.
Yep.
That sounds
I've got
right.
it marked.
Mhm.
Yep.
Okay.
So back on, and is there another thing?
Well, I kind of skipped ahead. I'm
No, that's
sorry.
fine.
I was looking at the timeline.
Yeah, no,
So
that's good.
there is one other thing on the timeline that I'd like to discuss, but if we, I don't know.
You can discuss.
Okay, go now.
Mhm.
The pocketbook thing.
Mhm.
That was something that we had talked about. And I think I just need clarification on. I guess my thought would be, I know we're working hard on policies and procedures, so do we need both?
we can scratch, I mean, we don't need to do
The
that.
pocketbook isn't for us so much as it's for the contractors, so they know our requirements, what we're, and that might be changing in the next year with chapter 69 getting revised. But we want the contractors to have something that they can have on their person, that they can reference what our requirements are.
Okay.
And-
Personally, sorry, go ahead.
I think when we have our annual contractors meeting, we can think about doing that. You know, we don't, it's not something that we need to do right now, but
It's
in
not
the
something
near future, I guess.
that I could see being super time consuming either. I don't think that would take long to create. It's,
For that particular group,
yeah,
right?
it's,
For that particular group and that environmental.
yeah.
But
I
the
mean,
way this is written, it
yes.
would be
it is,
broader than that.
Yeah.
So,
I don't,
And 69 is getting revised anyway,
it is.
so it might be good to wait
Wait,
until the
yeah.
revision comes out.
I would say in the next, 69, they said they pushed out like a year, so we could.
And this could just be something that's not part of the plan, rather something that we, if we have time with, it's something that would work.
I think so too. I definitely see a need for our department to communicate to contractors and take that, leadership role and really laying out what the requirements are and what our expectation is of them. But maybe more so through policies, procedures, and education. And a pocketbook, if that works, great, but I think we need to start first with the basics.
That can be an extra.
Yeah.
Yeah.
So does that mean we want to strike it or we want to move it?
I don't
do
care
you
for the
think, Bailey?
term.
Like Noah said, I think it's something that we can do on our own time. I don't think it needs to be in.
It could be struck from the.
Yeah.
strategic
Okay. Gotcha. Let me go find that up here too. Sorry, I'm jumping back and forth also.
It would be kind of too bad if you did a whole thing and then everything changed
Yeah.
next year anyway.
okay, and I'm not sure what page this is. Probably shouldn't number the pages. Are they numbered?
They are.
Are they numbered? Yeah, they're not on my copy, but, anyway, let's see. 2.3, leverage social media and other communication platforms for increased engagement. And,
Oh, sorry.
so here, you're going to be launching targeted social media campaigns. You're going to conduct monthly webinars addressing prevalent health topics. And you're going to redesign the website.
That's ambitious.
That's
That's
very ambitious.
ambitious. I agree.
I mean, the monthly webinar is a lot. If you did 2 in a year, that'd be great. You did 2 webinars and 2 town halls?
Yeah.
I didn't realize we had the webinar.
I didn't, yeah.
I don't even,
You know, in 10 years?
so what do you think of 2 webinars? I mean, does anyone here know how to do a webinar? Because I certainly don't. Do you know how? Good. Preeti will help us. But I don't think anyone in our department's probably ever done a webinar. So there's a learning curve there too, and maybe there's even, more software or something that we need to do that. I don't know. Cause I don't know how to do it, so.
You could even, I mean, this is kind of stealing, but, during COVID, Mary Rose did those very short Facebook series that were very informative.
Like a PSA, but longer.
Yeah, but longer, but a very short, I mean, that may be something that you may get a little more traction to than.
You know
big
what might be
webinar.
kind of fun is a Facebook Live of testing the wells.
Right,
Yeah,
like,
you know.
something like that might get, I mean, it's a little different, I don't know, it would be easier than.
Than a
webinar.
formal webinar.
Yes.
Mhm.
When I think webinar, I think interactive. Maybe I'm wrong.
Lecture.
It's a lecture, it's more like a lecture, I think, and I think you can take questions maybe, but yeah, I think it's.
You can make it on demand, so you can pre-record it
Right,
and
yeah.
just stick it on a web page and then it would be an informative
Yeah.
series.
Yeah,
Like sometimes the hospitals will do, this will be on prostate health, this will be on
Right.
stroke, this will be on whatever, If you're focused on a strategy of some sort, then you could have a webinar about it.
So I can amend the language to be 2 per year, conduct 2 per year webinars or Facebook Live or similar broadcasted sessions on specific health topics. And then they could be archived and you could share them, on your website.
Start with measles and vaccines.
okay. Does that sound good to everyone?
Yeah,
Does that sound doable, more doable?
it does. Yeah, I think the term webinar throws me off a little bit. I think it's a little bit
Webinar seems like
intimidating.
it's an hour-long program.
Yes,
Yeah.
yeah, presentation
Mhm.
to somebody's talk
Mhm.
with a few questions and answers at the end.
I'm Googling. I don't know what a better word for that would be. That's not quite so intimidating, but maybe you have something.
I could just say conduct monthly asynchronous live sessions, and then you could fill in the gap with whether it's a webinar, a Facebook Live, or whatever.
But not
Not
monthly.
monthly.
Two a year. At least, maybe at least.
Oh, I'm sorry,
4.
2 a year. Yeah,
You
right.
wanted to do more if you found out they were kind of fun.
Yeah.
you
Yeah,
could.
no, I've got you.
At least 2, that would be good. And also, I mean, actually, you could have guests do the presentation.
Mhm.
Yeah.
And then we could just like put it on
Yeah,
our
you
Facebook
could,
page or something. So I
Well,
mean,
and you could do like a tour of Crescent or,
Yeah, resources.
yeah, DNA
How
or
to use Narcan.
how to use
Yeah.
Narcan.
That
You bet.
would
Yeah.
get you,
Yeah.
that's a great informative. Where are the Narcan?
Where are they? How to use it?
all good ideas, but takes time.
I
And
would vote to scratch the word live. Because it doesn't necessarily have to be live. That's putting a lot of pressure.
I love that idea.
It could be live though, but it doesn't have to be.
Like questions in advance.
okay, any other questions or comments about that page, 2.3? Okay. Moving on to strategic goal number 3, optimize internal policies and practices for clarity and efficiency. And
This one's gonna take a lot.
yeah, this is a lot too. If you look down under 3.1, you're going to conduct a thorough review of all existing policies and procedures. Now, that won't take long because you have that.
Thank you. Beat me to it.
But creating
Huh?
standard operating procedures for common processes, that is time consuming.
It is time consuming,
And challenging.
but it needs to happen.
Yes,
And
yes,
of
yes.
all of the things
Yeah.
in this plan, to me, it starts here.
Yeah,
Um,
would there be a way to divide it into sections and like this year you're going to totally finish, I don't know, environmental health policies and procedures? Or you're going to do personnel policies and procedure, so that you're not looking at doing
Yeah.
all of
the
them
big chunk.
in the first year,
Right.
kind of, bite it off, so that would be an idea that I would have.
Can you borrow? I mean, do you know from other public health? I mean, I wouldn't recreate a wheel on,
Right.
at least a place to start.
Right. Yep, I agree. Yeah, I already did kind of start that with one of the other neighboring public health departments who's very kind to share what they have, and they don't mind if we use any or all of it. So yes. If I'm being honest, for me, it's finding the time, having the time to do it, because there are things that come up. I mean, you guys know all the time, and that's a me thing. I need to figure out a schedule. Maybe it's one day a week where it's dedicated just to that, because currently I'm saying, okay, when I get this to-do list done, I'll work on.
Yeah, this has to be,
policies, and
this
it's
needs
not
to be a
there.
priority.
Yeah.
And I don't know, I mean, because of strategic goal number 3, does it feel like it's less of a priority? I don't know.
Oh, just the ordering of it?
Yeah.
They're not in any particular order, are they? The strategic goals, like in order of.
Right. They're not like strategic goal 3 is not more important or less important. Yeah.
Feel to you,
Oh.
like, it's strategic goal 3, I'll do 1 and 2 first. See what it's a
Oh,
personal thing more
Well,
than
I
a
think, yeah.
procedural thing.
No,
sort of
and-
psychological thing.
Right, totally psychological.
Yeah, they're not based on importance and they're not based on any sort of temporal expectation of timing because so much of each one of those things is sprinkled throughout the 3-year timeline. I was just scrolling through the timeline. I want to remind you, you don't have to do all of this at once, and you're not. As a matter of fact, a lot of this doesn't even start until 2025 and ends in 2026, because you're starting, as you said, from the ground up with developing policies and procedures. Now, of course, some are going to be more important to do sooner than later, but some can wait. And so I remember having that conversation with our last session, trying to capture that. And again, we can revise it however you think important. But I just don't want you to feel like everything has to happen in 2024.
So, then I mean, it's a concern that it's all listed under July of 2024, conduct a thorough review of all existing policies and procedure and create standard operating procedures. So
The
somehow,
review's not gonna take that long, but it's the,
somehow you have to, make sure that that does actually like make a schedule and I think this plan needs to come back to us, but this is something, Al, you and the department probably need to talk about, and that is what kind of a schedule would you have to get all of these done in a period of, what do we have, 3 years? Not 1 year, but 3 years. And so then you would prioritize them and say, I need to do these this year. Next year, let's do these.
I see what you're saying about July. Can I make a suggestion about that?
Yeah.
That would help. So conduct a thorough review, easy enough, including creating a schedule in July. So that's your goal is by July, you've created a schedule of which policies and procedures need to be developed for common processes. And then you can implement the schedule moving forward. So that might be a
feels
better
good.
language.
Very, very good. Yep.
Okay, I'm going to make that change. All right.
Okay. Any other comments about 3.1? Oh, these two are very important too. They're number 3 and 4. Develop a standardized protocol for periodic interagency and interdepartmental policy reviews.
oh, yeah.
And then this next one, has to do basically with the VNA. Detail formally the responsibilities of entities who provide contract services to the health department.
Yeah, and this will probably come actually to you guys next month. We actually looked at the contract that we had. Are you aware of this?
Just briefly, I was here last time when we were in there.
Yes, yeah, okay. So we are looking to better outline those. And I have a draft actually ready for each of the grants that we contract. The language is the same for all of them, but it definitely meets this objective. So we're already doing that, I guess is my point.
Good.
Is this someplace else in the review or in the plan? And that is like auditing, sort of, is what I'm questioning. Auditing, is the VNA doing what we've contracted them to do?
So we've kind of built in a system, I think that maybe happens without, it just happens maybe without even your knowledge. But anytime a claim is submitted to the grant from the VNA, that claim itself identifies the work that's been done. And so when the VNA sends those claims to the state, I get a notification. She sends it directly to me as well. And then I have been saying reviewed and approved every month.
So it's an internal audit.
It's,
Really?
a system of checks and balances.
Well, and we also, like, as part of our, like, public health services grant and stuff, if we have any site visits or reviews like that, Ally, if it's contracted through Board of Health, Ally is kept abreast of all of those and sees those reports in the Iowa grant system.
Okay.
But just because it's happening doesn't mean it's coming to the board. So if that's something that you guys would like to see regularly, I don't know, that would be,
I think the only reason we'd need to see it if there was an issue.
Right, I was gonna
Yeah.
say, I mean, I think you as the leader of the department, if you're approving it and
Yeah.
that's your audit, I don't see a reason why we have to double check it.
Right.
Cause that's micro.
Is,
That's way micromanaging.
it just,
Yeah.
that is probably one of the policies and procedures that need to be formalized, just that you are in fact doing it, and this is, this is how you're doing it, so. That's what I'm thinking, yeah.
But I do wonder about 3. Is there interagency and intradepartmental policy reviews that need to happen?
well, to me, they're two really different things. So interagency would be like BNA, Dubuque County Public Health, City of Dubuque. I don't know that I don't know how we would develop a standardized protocol
Yeah,
for that.
I'm confused by that.
Do-
3.1
Wes, do you
bullet
have any
3.
insight on, do you remember what that meant?
So for interagency and interdepartmental policy, think about MOUs. A lot of times you're working across lines that aren't official. You might be sharing resources, or you might be partnering up on a particular initiative. And so you're probably working by MOU. And that's what we mean by interagency policy reviews. Now, intradepartmental policy reviews are slightly different. That would mean if you had your opioid folks working with your health ed folks, and there was some policy that needed to delineate whose responsibility was XYZ task because of the grant funding, for example.
Okay. So the interagency is an example that I would give is that we're working with, how do I want to say this? Places if we need an emergency response.
Yeah.
So,
Get for points of distribution, so
Points
we're
of distribution.
getting we're trying to get contracts in place for different point people within each town and the county to get MOUs to each of those places. So
Have we had those before?
we have very little.
That's what I
none,
thought.
Almost.
Mhm.
And
Okay.
yeah, so we're working on that right now to get points of distribution.
Okay.
so that would be an example, right? Of,
Yeah. Yeah.
okay.
What's an MOA?
Memorandum of agreement
Oh, okay,
or MOU, memorandum of understanding.
like kind of a contract.
Contracts.
Okay.
Okay, I was just wondering, cause I didn't think we'd ever done any of that before, so. But we're already doing it, sounds
Yeah,
like,
we're
so,
Working on it.
okay, great.
And then
Sure.
Yeah.
the second one under that category, identify redundancies and inefficiencies within the policy framework, particularly related to coordination with the city of Dubuque and state and regional public health agencies. I mean, that's gonna take meetings and things like that too, so that's gonna take a little while, be a little time consuming, I think.
Does that bullet point, do all of these bullet points fall somewhere in the
Timeline.
timeline? Yeah.
Yeah, they should. Let's see.
So
Scroll down here at the,
oh, it's January 25.
right. Yep, there it
Okay.
is.
That
Okay.
one seems. I don't know, that one just seems big to me, and what are you gonna do with it? It's kind of a sticky wicket with, especially the city of Dubuque.
I'm trying to think back to the conversation we had and why this was added in.
But aren't you gonna have to have all your policies done before you, or at least you're gonna have to know what you're working on to identify?
Yeah.
Well, particularly for services that you both might be providing. So not every policy, but certainly,
Right.
So maybe January 26th would be a better target than January 25.
we could do that.
Yeah, I agree.
Okay.
So I guess also another, for, again, that interagency, that'd be the Dubuque Humane Society too, probably.
Humane Society, yep.
Yep.
Okay, anything else on that section? Next, fostering a positive workplace culture. We're gonna make some changes to that. How else can you foster a positive workplace culture without using anagram?
Well, I've struck this out and I'm going to make a suggestion that maybe this becomes a sub bullet when we start talking about hang on, I'll scroll down here. Departmental workforce and future resilience. And so when we're talking about developing professional management systems for performance, we end up creating a sub bullet or a key initiative related to this, and we just eliminate 3.2 altogether
Yeah,
as a specific strategy.
yeah. So
So I'm folding, yeah, I'm folding it in.
3.2.
All right, 3.3 is implementing clear communication channels for policy dissemination.
Hey, I'm sorry, guys. I have a previous engagement started at 6. Was this supposed to go to 6 or 6:30?
Well, usually we're finished by 5:30, but because it's a work session, we're kind of going over, so.
Oh,
But
do you need
usually-
me for quorum?
No.
If so,
No.
okay.
No.
All right. Okay.
Thank you,
All right.
Todd.
Thank you. Bye.
See you soon.
Thank you.
Okay. So you're going to develop an accessible online platform for policy distribution and updates. Is that part of redeveloping our website too, do you think?
Well, this would be more like a Google Drive, wouldn't it?
Yeah, you need a centralized place for all of your policies internally, and then sharing out the things that your partners need or interdepartmental collaborations need. So yeah, a Google Drive would work. Some people use Dropbox or Ignite, some cloud-based system, and then they tier access to the policies that are relevant to the different parties who need them.
The shared folder. Fancy way of saying a shared folder.
Yeah, sorry, yeah, shared folder.
No,
Okay. Any concerns about this strategy?
No, I think it's a great idea. It needs to happen.
Okay.
I don't know what the timeline for it was, because again, it's gonna depend on when the policies and procedures. So it might need to be pushed back, but
Well, this is one you could create now, even if it's an empty folder. And as you create
oh,
them,
true. And then you
know.
just drop them in, yeah.
yeah,
So we're moving on to strategic goal number 4. Equip departmental workforce for superior service and future resilience.
So
Oh, there's
continuing
where the audits,
education.
yeah.
Training.
Yeah, so that's not totally within, I mean, you have a budget for that, and I don't think it provides for continuous quality improvement, but
But
maybe it does.
provides for quality improvement.
Yeah.
And once you start finding continuing ed things, you get more emails, so
Yeah,
then you
yeah.
find more, so.
There's a lot
Then
of
it
free-
becomes
I was gonna
continuous.
say, but there's probably.
There's a lot of free ones out there
Yeah.
too, and there's some that don't charge.
Well, like I just said, Carissa, thing for a whole weekend, I think, substance use disorder webinars. So I'd like 20 CEUs worth. So, and then you'll start getting more and more and more like.
Yep.
So it'll be.
Something for her to do on the weekend? Anyway,
I don't know what it is.
I don't know.
I'm just looking for it to pop up. It's time to log on.
I guess I'm uncomfortable with the word continuous. Provide continuous quality improvement,
Continuing, do you like that better?
or just
And
provide quality improvement training?
I mean, that's.
Sure.
Continuous quality improvement is kind of.
It's an
the-
industry.
It's an
word.
industry term, continuous quality improvement. I
Oh,
mean,
really?
that kind of goes together, but, and I guess I don't even think of it as continuous just because that's
Oh,
just like.
it's like
everyone
jargon?
knows. Yeah, it's just
Yeah.
kind of.
Yeah, CQI. So we're going to train them on how to do continuous quality improvement. The idea that everyone there has the skills and the knowledge to put in place some
Oh,
basics
okay.
of an ongoing assessment and evaluation of what you're doing, how you're doing it, the impact, that sort of thing.
Okay.
That you're always working to improve, so it's not like.
And then here's these KPIs again. Establish and monitor key performance indicators and quality metrics to gauge service and quality. I mean, that's all good. Just depends upon where it falls in the calendar there, so.
And you kind of need some of your data to do that too.
But it's kind of like a rock rolling down a hill, you know, it
Right,
starts slow,
yes,
but then
yes,
and
yes.
it just goes
You
by
might
itself
only
after a
start with
while.
one or two things, but then you're gonna pick up.
And then here's the conduct regular audits of service delivery processes. Do you understand what that means?
So that what that really means is in just on your regular calendar, once a year, maybe twice, but certainly once, you take the 30,000-foot view of all the operations you have in the health department, and you get some input from the data that you've collected from clients and customers and citizens, and you talk to your folks and you try to identify areas for improvement. It's really all it boils down to. That could be you look at the last 6 months of data and oh my gosh, our response time to these requests have been really low. What can we do to change that? It may be overcomplicated by the way it's described in the bullet, but it's really just once a year taking that 30,000-foot view of how are we doing, which parts are not functioning as well, and what can we do to help that out.
So Wes, that's a staff thing to look at, or is that a committee on the board?
No, that's a staff thing. I mean, that's Ally and her crew getting together and saying, all right, functionally, what are we struggling with the most, and what information do we have to help us understand it? And then what are we going to do to fix it?
How do you guys feel about that?
Yeah, I think it makes sense. I'm all for plain terms, so I think you're right. I think it made it sound a little bit.
You did.
Yeah, let me revise the
Maybe an
language on
audit
that.
instead of A yearly audit, you know, maybe that would be,
Yeah,
change it to yearly audit instead of regular audits.
sure. And I'll try to play with the language in that. I can read that and tell you right now, David Tillman wrote that.
Yearly review.
Service delivery process.
4.2.
Yes, aligning professional development to address emerging needs. So here you're going to conduct a comprehensive assessment to identify skill gaps.
Well, and I think you're already doing that.
Yeah, I would like to think that the data platforms would provide us with
Mm-hmm.
that continually. So that would be an ongoing thing.
Well, and this has to do with, doesn't this have to do with the employees of the health department?
Yeah, the trainings.
Mm-hmm.
The skill gaps within your department.
But like,
Yeah.
I'm sending you guys stuff all the time, even if you don't ever go to them, I'm still sending them to you, so I think we're doing this already.
And you, on your yearly evaluation of staff, if that kind of correlates with the job description, you can, like, if, you know, I came to work for you and I was supposed to know how to test well. I mean, some of those things you're just gonna naturally identify. as-
Yeah, with
as
certification
skill
to be
gaps,
reviewed.
yeah, yeah.
Bye, Diane. Thanks for coming.
See ya. Was there something in there that stuck out to you, Sandra, or?
Well, just conduct a comprehensive assessment, to me, that seems like a formal thing that when the board goes to evaluate Ally at the end of the year, they'll say, where is that? Could I see that, please? You know what I
So I'm
mean?
gonna suggest we say integrate into the annual reviews.
Yeah, I was gonna say, isn't that your annual reviews?
Good idea.
And then, who's going to develop tailored training modules and workshops?
I think it might be better to say like, identify.
Mhm.
We're not
Absolutely.
gonna develop it, we're gonna seek out what areas we feel like we're lacking on and find trainings that meet those needs.
Yeah, that's a wise change. So I'm just gonna change develop to identify.
And we're already doing the cross training,
Mhm,
right?
mhm. And getting partnerships with academic institutions.
Yeah.
Doing that.
Yep.
Okay, 4.3, creating performance management systems tied to professional growth. Does that mean evaluating employees?
Do all county employees have the same evaluation, or do you have your own for this department?
I don't think there's even one right now.
Oh, okay.
How do you do?
Oh, okay.
The county's
Never
trying
mind
to
then.
develop some things, but that's gonna be a slow process too, I think.
Yeah, yes,
Yeah.
and that's why,
They're going over job descriptions, I think, but,
yeah, it's definitely a work in progress.
yeah.
I think this will fall into place once you get policies and procedures and continuing. I mean,
Yeah,
this is just
yeah.
kind of like the end result
Yeah.
is step 4.3, strategy 4.3.
I'm not
But-
sure about the last one.
Yeah,
A structured program to incentivize employees' accomplishments and milestones.
Well, I mean, it's not a bad thing to have, maybe an annual review at a board meeting and say, hey, here's, like we kind of do with the water stuff that, you got another $50,000, woo, that's, I mean, like Dubuque County is the only one that does that. So to, tout those, I think it'd be a good thing.
Oh, yeah, I do too, but that's not the way this reads to me.
No, but I think that's what we could make it into as a,
We could change
Some
incentivize to recognize.
yeah,
Yeah.
an annual review of all the positive accomplishments.
Right, not necessarily, because if I read this, it's like develop a way to give each person a raise instead of, but you're talking more of acknowledge what's good that's been.
what's
done.
been accomplished.
Yeah.
Sort of, yeah.
We can give you guys good pats on the back, but we can't give you
Right,
$10,000 raise.
right, and that's- I mean, that's what it incentive, when I see incentivize, it makes it looks like.
Yeah, like we're all getting a beach vacation.
You're all- Good job. Good job.
There you go. Okay, so we could just change that word.
Yeah, I changed it to recognize.
Thank you. And then really,
And these are the things we just went through, just organized by timeline.
yeah,
And I'll,
I would just urge you, Ally, and maybe the department to review this carefully with Wesley and David. And get it so that you're sure that you can accomplish this, because this is so easy to look at. Someone's gonna be evaluated based on that.
so I think we made some good changes today, and then Wes, if you could just send me the revised version with the changes we made today, I will go through it carefully probably on my own, and then maybe we can just email back and forth.
To them.
Sure.
I just want I want you to make sure that you're putting this list of actions
Mhm.
in such a way that you can accomplish it,
Mhm.
so.
Okay.
Well, the other thing, and this is like maybe another annual thing to do, because the way the supervisors have structured things now, there's always gonna be two people leaving the board. And so by 2027, it's gonna be Pat and Tut. are the only two that are still gonna be on. So every year pulling this out and letting the new board members see it too.
Sure.
What was that?
Oh, actually, you'll be out on 26. Everybody will be gone. By 27, it'll be a whole new board. So that's right. Yeah.
We adapt pretty
You
easily
might,
in any of
you
these
might
areas.
be able to get in on another one if you were filling an empty spot, but.
She's like, I'm on a beach somewhere.
But I mean, that's just something else just to keep.
Okay, so
Yeah.
procedurally, once you get this in a finalized form, you can send it out to the Board of Health, but I think we have to formally adopt it with a vote.
Okay.
So that'll have to be next meeting.
Mhm.
And then I think, and we'll have to check on that procedure, I think it has to be presented to the Board of Supervisors.
Even if it doesn't have to be, I think they would
You would,
appreciate
yeah,
it.
I
Yeah.
think so too.
You know, somebody said, and Wes, you might want to hear this, somebody said, it's so short, it's so anemic. And I said, honestly, there is so much work to be done in this thing. I said, but it's written in such a way that it's easy to pull out and say, oh, this is what I'm supposed to be doing.
Yes.
So, I mean, I'm happy with the way
Oh,
that it is,
I am too.
yeah.
I am too. I think the whole process was great from start to almost finish.
They told me that they expected like maybe a 50-page document.
Oh, wow.
Yeah.
And I said,
Now, who has a 50-page strategic plan?
exactly, and I mean, it would be so hard to deal with, you know, to try to, yeah.
Because there's a lot of work into this one, even though it's not 50 I mean, there's a lot of,
There's a lot of work to be done.
that's what I mean, there's a lot of work to be
Yeah.
done within these pages.
Yeah.
Less is more.
Well, and this
If you
is
can
the
get long.
structural framework. Maybe they were thinking to have everything
busy work, yeah.
totally listed out. I don't know
know.
how you get 50
Yeah.
pages or why you'd want 50 pages.
By the time you have implemented this plan, you won't have 50 pages. You'll have 100 pages of data and policies and procedures and evidence and all sorts of things. And so, you know, it is the fact that this is the beginning of big stuff. But it is also, you know, everybody starts out on a road trip. They've got a map, but everything that's going to happen on that road trip is not in your plan. And so by the time you get to the end of that road trip, you'll have all of that. You'll have the photos, you'll have the journals, you'll have the souvenirs. You don't have it at the beginning.
Yeah.
Stars.
That's a great way to explain it. I like that.
Very
Is this
good.
the first strategic plan
Uh-huh.
we've had?
First ever.
First ever?
Good things ahead.
Nice, yeah.
All right.
All right, thank you.
Very good.
all.
Thank you everyone for your input and, studying this document, and it's really gonna put the department on good footing, I think. So we can have a motion to adjourn. Okay, we're adjourned.
Thanks again, Wes.
Thanks,
All right,
guys.
thank you very much.